Welcome to PNF in Practice, an illustrated guide. This comprehensive resource, authored by Susan S. Adler, Dominic Beckers, and Math Buck, explores the philosophy, techniques, and practical applications of proprioceptive neuromuscular facilitation, PNF, in physical therapy. Susan S. Adler, Dominic Beckers, and Math Buck are internationally recognized physical therapists and PNF instructors. Their combined expertise has shaped the development and teaching of PNF worldwide. This book is dedicated to Maggie Knott, a pioneer in physical therapy, devoted to her patients and students. Her legacy continues to inspire the field of PNF. Proprioceptive neuromuscular facilitation, PNF, is a treatment concept based on the philosophy that every individual has untapped potential. PNF integrates the whole person, focusing on mobilizing patient reserves to achieve the highest functional level. The PNF philosophy emphasizes a positive approach, functional goals, intensive training, consideration of the whole person, and the use of motor control and learning principles. Treatment is always tailored to what the patient can do, both physically and psychologically. Motor learning in PNF involves cognitive, associative, and autonomous stages. Facilitation techniques are adapted to each stage, using visual, verbal, and tactile cues to guide patients toward independence. PNF techniques are grounded in neurophysiological principles such as after-discharge, temporal and spatial summation, irradiation, successive induction, and reciprocal innervation. These mechanisms enhance muscle activation and coordination. PNF uses a set of basic facilitation procedures to help patients achieve efficient motor function. These include resistance, irradiation, manual contact, body positioning, verbal commands, vision, traction, stretch, timing, and movement patterns. Resistance is a key element in PNF, used to facilitate muscle contraction, increase strength, and aid motor learning. The type and amount of resistance are tailored to the patient's needs and the desired muscle contraction: concentric, eccentric, stabilizing isotonic, or isometric. Irradiation refers to the spread of muscle activity in response to resistance, facilitating synergistic muscles and movement patterns. Reinforcement strengthens weaker muscles by resisting stronger ones, allowing therapists to tailor treatment to individual needs. Manual contact provides tactile cues, increases patient confidence, and guides movement. Proper body positioning and mechanics allow therapists to deliver effective resistance and control without fatigue, ensuring optimal patient outcomes. Verbal commands guide movement initiation, strength, and correction. Vision enhances muscle contraction and helps patients control and correct their movements, providing essential feedback for learning. Traction elongates limbs to facilitate motion, while approximation compresses joints to promote stability. Stretching muscles, when appropriate, enhances contraction and prepares the body for movement. Proper timing ensures smooth, coordinated movement, often from distal to proximal. Timing for emphasis can redirect energy to weaker muscles. PNF patterns are spiral and diagonal, combining movements in all three planes for functional synergy. PNF techniques are designed to promote functional movement through facilitation, inhibition, strengthening, and relaxation. Techniques include rhythmic initiation, combination of isotonics, reversal of antagonists, repeated stretch, contract relax, hold relax, and replication. Rhythmic initiation involves moving the limb passively, then actively, and finally with resistance to teach motion, improve coordination, and normalize muscle tone. It is especially useful for patients with difficulty initiating movement. Combination of isotonics combines concentric, eccentric, and stabilizing contractions of one muscle group without relaxation. This technique enhances active control, coordination, and strength throughout the range of motion. Reversal of antagonists involves alternating contractions of opposing muscle groups without relaxation. This technique increases range of motion, strength, coordination, and endurance, and helps prevent fatigue. Stabilizing reversals use alternating isotonic contractions to increase stability and balance. Rhythmic stabilization uses alternating isometric contractions for increased stability, strength, and pain reduction, especially when motion is not desired. Repeated stretch uses the stretch reflex to facilitate motion and strength. Contract relax and hold relax techniques increase passive range of motion and decrease pain by using resisted contractions followed by relaxation. Replication is used to teach patients the end position of a movement or activity, facilitating motor learning and functional independence. The patient practices holding and repeating the movement from different starting points. PNF treatment is based on a systematic evaluation using the ICF model. Therapists identify areas of function and dysfunction, set SMART goals, and design individualized treatment plans using direct and indirect techniques. PNF patterns are spiral and diagonal, combining movements in all three planes. These patterns involve mass movement of limbs and trunk, enhancing functional synergy and allowing indirect treatment of related muscle groups. The scapula and pelvis move in specific diagonal patterns that are essential for trunk, neck, and limb function. Scapular patterns include anterior elevation, posterior depression, posterior elevation, and anterior depression. Pelvic patterns include anterior elevation, posterior depression, posterior elevation, and anterior depression. Scapular and pelvic patterns are used to facilitate rolling, trunk control, gait, and functional activities. These patterns can be combined symmetrically, reciprocally, or asymmetrically to target specific functional goals.